This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. This morning, we are going to discuss Aquablation. Good morning. Welcome into Mon Health Talk. I'm Dave Wilson, and coming up on the show today, we'll be discussing Aquablation Therapy. What is it? Well, I'm glad you asked. We'll get into that topic today. Joining us on the show, Dr. Shakuri Rad. Good morning, Doctor.
Good morning. How you doing, Dave?
Doing quite well. Is it just you this morning, or do you have someone with you?
No, I'm here with Bre, who's
okay.
Working with us.
Just wanted to make sure she was also there. Bre Smith, medical specialist, service line director, Mon Health System. Good morning, Bre.
Hey, good morning, Dave, and thanks for having us today.
Well, thanks for coming on and spending a few minutes. I'm running out of things to ask Dr. Shakuri Rad in this opening segment. You're a friend of the show. You've been on so many times. Trying to think of a new question to ask about your background, but I can't come up with anything. So just to remind folks a little bit about your history and how you ended up with Mon Health.
Sure. So, I graduated from Parkersburg High School, as you know, and interesting thing with Bre and I is that Bre actually went to the other school.
The better school.
So she's a graduate of Parkersburg South High School, but, this shows that, two rivals can work together very well. After Parkersburg, I went to WV for undergrad, WVSOM in Lewisburg for my medical training, and then I went to Michigan for my urological training and advanced robotics training. And I'm back home to serve the people of West Virginia.
Wow, I didn't realize we had a Parkersburg South rivalry on the show today. This could be interesting here for the next few minutes. Bre, go ahead and tell us about your background. We now know you went to Parkersburg South.
Yep, so I was born and raised in Parkersburg, and then for college I came up here to WVU, got my undergrad in biology and in also industrial engineering, and just never left Morgantown. My husband and I fell in love with it, so we never left. I think that happens a lot up here. So
Yeah, we hear that story. That Morgantown has a way of getting a hold of you like that. Bre, how did you end up with your specialty?
Yeah, so, with my undergrad, with biology and industrial engineering, I knew that I always wanted to do something in healthcare. And really, the mission, vision, and values of Mon Health really spoke to me. So definitely applied here, and this is definitely my home now.
And, of course, Dr. Shakuri Rad, a urologist, robotic surgeon. We've talked to you about a number of topics, but how did you end up down this path of urology and robotic surgery?
So I used to build robots as a kid, Dave, and I don't know if I ever mentioned this on the show, and I used to compete in robotics competitions. As a matter of fact, I started at a robotics club in Parkersburg, and then when I came to Morgantown for undergrad, I started one with Morgantown High School. We actually went to a national competition called U.S. First Robotics, and Morgantown High School won the national competition back when I was in undergrad. And so I always had a love for technology, robotics, and I also wanted to apply that in healthcare because that's what I was studying at the time. And so urology has always been at the forefront of medical technology and has been using robotic surgery for quite some time, over 2 decades. And that's how I ended up focusing my efforts on getting into a urology residency program and learning all I can to come back and help the people of the state with it.
I've got to ask, what kind of robots were you building back in the day?
See, most people equate it to something like BattleBots, except that's the popular show. But our aim in this competition was not. The robots actually look very similar to what you may see in a BattleBots competition, but the goal of the competition was actually to have the robots collaborate and solve certain tasks or certain, play certain games. And so it was quite interesting. If anyone ever looks up U.S. First Robotics, it's been around for quite some time. And the inventor of the Segway, which is a popular, transportation method, was the one that started this competition in the early 90s. So it's been around for a long time, and a lot of kids have really have been introduced to science and technology through that.
How cool. How cool. I said off the top of the show we were going to talk about Aquablation Therapy. Mon Health Medical Center's the first in North Central West Virginia to offer it. But what is it? What are we talking about?
So Aquablation Therapy, being now talking about robotics, Aquablation Therapy is a robotic procedure, and it's designed to help patients with a condition called BPH, or benign prostatic enlargement. The goal of the procedure is to remove tissue using the power of water. That's where the Aqua name comes from. Our previous treatments have always focused on removing tissue using some kind of a heat-based platform, some kind of cutting or burning of tissue. And this treatment is novel in that it uses water, and similar to what you may see with a pressure washer, for example, it uses that kind of strength of water to remove tissue in a very safe and effective fashion. The treatment is performed in a hospital. It's done under anesthesia, and procedure typically takes less than an hour to do, on average about 45 minutes. And it involves an overnight stay, but in select cases, I can send patients home the same day.
And what's really great about it, too, is, with our previous type of procedures, we were really limited sometimes based on the size of the prostate or, various factors. So this opens that up, and we're able to do this procedure with some of the larger prostates that we weren't able to do in the past.
All right, we got to squeeze in a break, and when we come back with Dr. Shakuri Rad and Bre Smith, we'll get into the patients who would qualify for this therapy, what are the benefits to the procedure, the differences between this one and other treatments. We're going to cover it all over the next few minutes, but we got to squeeze in a quick break. First, our guest this morning, Dr. Shakuri Rad, a urologist and robotic surgeon, Mon Health Urology, and Bre Smith, Medical Specialties Service Line Director, Mon Health System. And you're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Shakuri Rad, urologist and robotic surgeon, Mon Health Urology. Bre Smith, Medical Specialties Service Line Director, Mon Health System, our guests on Mon Health Talk this morning. We are discussing Aquablation Therapy and which or what patients would qualify for this type of treatment.
Yeah, so I think before we cover that, it's important to know that this is a very, very common problem for men. And, Bre has been doing this with me for a long time now, and she's become an expert in statistics on this. So I'm going to let her share some of the stats with you in regards to, how prevalent this disease is.
Please.
Yeah, so BPH is actually the number one reason men visit the urologist. And it's estimated that 1 in 2 men ages 51 through 60 have BPH, and that prevalence increases over time. We know our population is aging, so, this hits a significant portion of our community. 99% of men with BPH say that symptoms impact their quality of life. So, as we looked at this was a no-brainer for us to bring this to our community and be able to offer this to our patients who are really in need of this procedure. It's estimated that 40 men in the United States have BPH, and that's expected to double in the next 10 years. So it's definitely something that we're very glad to bring to our patient population.
We always talk on this program about prevention and catching ailments and catching things early, and the earlier you catch them, the earlier that is to treat them. So when we're talking about BPH, we're talking about the prostate, when do men need to start going in for those annual exams so things can be identified early on and treated much more effectively?
That's a great question, and prevention is always a priority for us. Unfortunately, with BPH, as men get older, testosterone in our bodies stimulates the prostate to continue to grow, and the prostate will grow. Each man will have a different growth rate, and at some point in their life, they'll face significant bladder problems, lower urinary tract symptoms, we call them. So they may have symptoms like urgency, frequency, a slow stream. waking up multiple times at night. And so we can't really prevent that. However, once these symptoms arise, we can certainly treat men. And, whether it's medical treatment or surgical treatment, we have all of the options available at Mon. And now with the introduction of aquablation, there certainly is absolutely no need for us to send men anywhere else.
So how would a patient qualify, or who would be a good candidate for aquablation therapy?
So men typically would come in and go over their symptoms with us. Then we would have them answer some questionnaires that would put them on a scale, whether their symptoms are mild, moderate, or severe. Then we would do a workup. We would simply measure their size of their prostates. We would measure their flow rates. And based on those results, we can tell them which option may best suit them. At the end, our goal is to provide them with choices. It's always choice is important. Just like patients have a choice in healthcare where they get their healthcare, they can also choose what treatment is best for them once we introduce risks, benefits, and alternatives to them. But majority of men would qualify for aquablation. There are very, very few that would perhaps be outside of the treatment spectrum of aquablation.
So what are the benefits to aquablation therapy?
It's the only procedure that uses heat-free water jet to remove prostate tissue. So typically when we use heat or cutting or cautery, we cause tissue damage. And that's usually required because we're trying to prevent bleeding, or, that traditionally those are the only tools that we have had. With aquablation, we don't cause the same type of damage we used to cause to tissues, and therefore the side effects are much less. In terms of the prostate, we're talking about side effects such as urinary incontinence. After the procedure, men may leak urine, sometimes permanently, and aquablation reduces that significantly. Also, sexual dysfunction is a big problem with a lot of these procedures, and again, aquablation preserves that sexual health. So because of those reasons, men tend to choose treatments that will prevent both of those complications.
Our guest this morning, Dr. Shakuri Rad, urologist and robotic surgeon, Mon Health Urology. Bre Smith, Medical Specialties Service Line Director, Mon Health System. And we're talking about aquablation therapy. We'll continue the discussion after this quick break. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. Shakuri Rad, urologist, robotic surgeon, and Bre Smith, Medical Specialties Service Line Director with Mon Health System, joining us on Mon Health Talk this morning. We've been talking about aquablation therapy and what are the differences between this type of therapy, aquablation therapy, and other treatments for BPH.
Yeah, so, one of the things I mentioned before was that heat versus water-based therapy. Another one is that, we obviously have introduced, and I've talked, I think, on this show about some of the firsts that we've introduced to the region, such as UroLift. It's a procedure where we don't use any heat, water, or and don't do any cutting at all. That procedure is usually used for smaller size prostates. Aquablation can be used across the spectrum of prostates, regardless of size. And then we have some advanced robotic procedures, much bigger procedures that we can use for patients who don't qualify for these less invasive procedures as well. And so at the end of the day, the goal is to provide a treatment that's effective, that is going to be long-lasting and reduces any kind of complications for the patients.
You touched on this briefly when you were describing the procedure early on, but what does recovery entail when we're talking about aquablation therapy?
Yeah, typically, most patients will spend the night in the hospital with us, and we'll have a catheter in their bladder for about 24 hours. Some patients may actually be able to go home, so like patients we send home, and those patients come back to our office within 24 to 48 hours to have a catheter removed. Aside from that, once that catheter is removed, then the patients go back to their normal daily activities very quickly. Pain-wise, it's really not very uncomfortable. Most of our patients so far have told us that this was actually a very pleasant procedure given what they're going through. And so we've been very, very happy with the results so far.
You know, we talk very often about the importance of really you want to get patients back home, want to get them back to their day-to-day. Why is that important to being part of the healing process?
Yeah, so I think that kind of goes with our Mon Health vision, right? We want to be a community hospital taking care of our communities. We want to get them back on their feet and back to the things that they love, their families. And so the things that we introduced to the region are all aimed at really getting these patients back home and so that they can spend time with their families again. We don't want patients to be hospitalized for, days or weeks because there are some procedures where you may have to stay in the hospital for a much longer period of time. And so any of these firsts that we have introduced really has the patient in mind, and Bre can talk a little bit about that vision that we have for Mon Health as we introduce these new service lines, whether it's our cardiologist, urologist, oncologist. We all kind of work together to really provide that comprehensive care.
Yeah, Bre, go ahead. We talk every week, like Dr. Shakuri Rad just mentioned, whether it's oncology, cardiology, about less invasive procedures, easier on the patient, getting them back home, getting them back to normal as soon as possible. So if you could expound on that a little bit.
Yeah, I think what's great about Mon Health is that we have service line models here. And so what that, what really happens before that is that we're able to create a comprehensive plan for the patient, whether they be, in the clinic, in the hospital, wherever they might be in their care. So, we're medical specialty service line, and urology definitely falls under that. But we can collaborate across, our spectrum of systems to be able to offer the all-comprehensive care for that patient. I think that's what's, wonderful about Mon Health. And not only that, we are a community hospital. We're treating each patient individually each and every time. So, we're able to offer these innovative, effective procedures that are, top of the line, but we're still a community hospital, and we treat each and every patient as, they're our own family. And I think that's what's great about us here.
Got about a minute left. Where can people go to get more information about both Aquablation Therapy and Mon Health Urology?
Yeah, so we do have two websites. You can visit monhealth.com/aquablation, or you can visit monhealth.com/urology, and that will get you the information that you need.
Dr. Shakuri Rad, a urologist and robotic surgeon, Mon Health Urology. Bre Smith, Medical Specialties Service Line Director, Mon Health System. Final question, Big Reds or Patriots?
Oh, Big Reds.
Guys, thanks so much for the information. Good information today. I appreciate it, and thanks for the time.
Thanks a lot.
Thank you so much.
Absolutely. Mon Health Talk again, Dr. Shakuri Rad and Bre Smith this morning.